Welcome to the Philly Doctors. I'm your host, Dr. Rabina. Thanks so much for joining us. We have an exciting show today because we're going to talk about the truths of oral health, from teeth whitening to jaw pain to foods that keep you in check. So let's meet our doctors. Of course, we want to welcome back Dr. Zach of Brewerytown Chiropractic. Dr. Jill, tell everybody about your practice.
Hi, I'm Dr. Jill Hoffman. I'm a naturopathic doctor.
Excellent. Next up.
I'm Dr. Derek Turner. I'm a general dentist in Center City.
Excellent. So let's get right to it. Are you worried about the color of your teeth? What do you think? When people come into your practice, is this something that they commonly say to you?
Not commonly. I mean, a lot of patients, I generally never bring it up to a patient. I let the patient mention it to me. It's not for everyone, and that's the route I like to take.
Okay. Anyone on the panel ever buy a teeth whitening kit online?
No. I have not.
No.
Not online.
But I've used one before.
But you used one before.
Yeah.
I bought one online. I was curious. And the reason why I was so curious is because it was pretty inexpensive. And so then it kind of caught my eye. I kind of wanted to try it out. And so I did. And it was interesting. It kind of came with a tray, a little syringe filled with, I'm guessing, is the bleach, and a blue light. So Dr. Turner, can you explain to us what's happening when we're buying these teeth whitening kits?
All right. So a lot of the teeth whitening kits that you buy over the counter or even online or TV ads late night, they're not specifically made for your teeth in general. So a lot of times there's a lot of problems that come into play. For example, some patients have a tendency to want their teeth really white, so they'll overuse it. They'll overfill the tray, they'll use it for longer than recommended just because they want the optimal results. Also, the concentration is very important. If it's a low concentration, then, some patients tend to think, well, if my teeth aren't sensitive, then I can use it longer. So I find that, especially when it comes to a dentist or someone who can monitor what the patient's doing and you don't want to damage your teeth and gums, it's best to have it done.
Because you don't know what the concentration is. Really, you could just add all this stuff into the tray. And what was interesting was I found that it kind of bleached my gums too. And is that going to be just because the tray is not properly fitted?
That's exactly right. If the tray isn't completely fitted to your tooth, then there's overspill, there's contact with the gums, and then what that will do is it'll whiten your gums, it'll bleach your gums, and then that can lead to recession and then more dental pain as well.
So it's not good. So in your opinion, are they safe? Are they not safe?
In my opinion, I think Crest white strips, anything that you can buy over the counter, as long as you follow the instructions, use it as directed, it's safe. Don't overuse it. However, again, it's not specifically made for your teeth.
And Dr. Jill, do you think that there's a lot of pressure for people to have whiter teeth? Or do you,
I think there is. I think that comes from Hollywood, and celebrities have very white teeth, and so people then can easily overdo it and do it too frequently and end up with a bluish color to their teeth, which is, and irritation, just from what Dr. Turner was saying about with overspill and with improperly fitted trays, that you can end up with gum irritation and inflammation.
Yeah. So check out this statistic. This one's interesting. According to the American Academy of Cosmetic Dentistry, Americans spent more than $1.4 billion on over-the-counter teeth whitening products last year alone.
Wow.
People want white teeth.
They do.
It's fascinating to me. So let's talk about this blue light. So what exactly is this blue light doing? So if you just use the bleach on its own with the little tray, is that going to work, or do you really need to stick that thing in? People take all the selfies with the blue light, and they post on Instagram.
Yep.
That's a great question. I mean, there are different types of bleach out there. There are some that come with a blue light, some that don't.
Okay.
I specifically shy away from using the blue light because it will dehydrate the tooth, and then that's where your sensitivity comes in. Now, the blue light specifically releases free radicals, and what that means is it creates a chemical reaction within the tooth. There's a bubbling reaction. This breaks up the particles that are on the surface of the tooth, and then that's where you get your whiter teeth. However, once again, you're dealing with a UV light, which we all know isn't very safe, but patients also don't know how to localize it to a specific tooth, and that's why I find it's a bit dangerous to leave that in the hands of someone who's not familiar with the product. But it's the same light that dentists use to set a white filling in your tooth. But again, if you notice, that's localized when the dentist is using it.
So what else can dehydrate the tooth? I think this is important.
I mean, alcohol and some mouthwashes can cause dry mouth. that's one specific. Just a dry mouth in general. Some patients that are receiving chemotherapy can also, that kills salivary glands, so then you'll have a dry mouth in that respect. A lot of things are genetic as well. Some patients produce more saliva than others. That's a factor as well.
So Dr. Jill, in your office, do you ever suggest your patients to stop drinking coffee? And how big of an impact do you think that has?
I think so. Coffee does stain teeth, but so do berries. And I never discourage people from eating berries because of tooth color. So caffeine in coffee is something that's a very individual choice. And if someone is having problems sleeping, I will recommend that they stay away from coffee, perhaps. But I think that there's some decent evidence behind having a moderate amount of coffee every day.
So there you go. If coffee is going to stain your teeth and berries, you might as well have both. This is where we're at.
Yes.
Because I can't give up coffee, that's for sure.
Like most people.
Right, exactly. All right, so let's move into a safer setting. So in the office. So if we came to see you, can you show us the goodies that you have in your office for
certainly.
teeth whitening and a bright smile?
Absolutely, I can certainly do that.
Okay.
So I brought today a couple of different components that we use in the office. I'll start off with the ones that we use that are specifically designed for your teeth. So what's done first is the patient comes in and an impression is taken of their teeth specifically. It's usually about a 5-minute appointment. And these flimsy trays, as you can see, they're pretty flimsy. This is where the bleach is placed inside the tray. So this first is probably the most popular bleach that patients seem to want. This is an in-office bleach. And basically, it's almost like caulking your tub. You're placing the bleach a straight line, I don't know if you can see that. It's a straight line.
So it's not really that much. It's like a very thin layer, and that's enough, right?
It is. It's a very thin layer. And what I also found, and this happened more personally, is that my brother had used one of our whitening kits and called me about a week later and said he was out of bleach. I found later that he was filling each individual tray tooth. So don't do that. It's one line. And again, you want to keep it minimal. What we do is we demonstrate first in the office so that patients don't overuse it. We also tell them that after they place it, wipe off the excess with a Q-tip as well.
Okay. And then how long do you leave this in your mouth for?
Great question. So this is the 45% that we use. The patient sits in the chair, reads a book, plays with their phone, whatever, sleeps. And this stays in for about 30 to 45 minutes exactly. They also will have a take-home kit that goes along with that as well. So that usually runs about $250 and to do that in office. The patients usually like a quick result. So you'll get a small change, then you go home, use the trays, and you get more of a change at that point. One thing that's really important, if I can stress, is that in this component here and the take-home, they both contain fluoride, which is important because a lot of patients are concerned about bleach breaking down the enamel. So that's one thing. It also contains potassium nitrate, which is the same component that's in anti-sensitivity toothpaste like Sensodyne. So this potassium nitrate helps with that. We also recommend that patients use Sensodyne maybe for 1 week prior to bleaching, just so that it can reduce sensitivity. Hopefully there won't be any.
And can you use this all the time? Like, let's just say you like it, maybe it's your go-to toothpaste.
You can use Sensodyne as your natural toothpaste, your normal toothpaste. It has fluoride in it. It's no different than any other toothpaste, except that it has potassium nitrate that prevents sensitivity.
Okay, perfect. That seems easy enough. Okay, and then how many times do you do the trays?
Great question. So with the trays, again, there's different components. With this specifically, you will get a change that day. So it generally differs. As Dr. Joe was saying, if you're a heavy coffee drinker, if you're a heavy berry eater, if you eat a lot of red pastas, anything, cigarette smoking, that's going to change the amount that you use. That'll change the results that you get to. I just leave it up to the patient. Every patient differs, whatever they're hoping to achieve and what their goals are. You have to be realistic about it.
And so how white can you really get the teeth? Is that really patient dependent?
It is very patient dependent. A lot of expectations are high because, as Dr. Jill once again said, Hollywood expectations. People that you'll see actually have veneers. They don't, crowns. They haven't achieved this from whitening. So if you think you're going to achieve that same result from whitening, you're not.
So let's talk about the veneers. Anyone here, would you ever think about doing veneers? Dr. Jill, no, never. Dr. Zach?
I would try not to, no.
Yeah. I might. I think about it. I don't know.
I was asked once if these were veneers, but they're not.
Yeah, we need teeth like yours. So how do the veneers work? How does that process work?
So again, it's something that I don't push, mostly because it's a reduction of the tooth, about 0.7 millimeters, just on the facial.
Shaving the tooth down?
You are reducing, correct.
Okay. And so is the patient awake when this is happening?
They are awake, they're numb, just as you're getting
like
a crown.
Cavity or okay. And then that happens, and then what happens after that, basically?
So what happens is what I do in my office, we'll take an impression first of the patient's natural teeth. We'll reduce a few millimeters off the front. We will take a second impression, which goes to the lab for the production of the veneers. That usually takes about 2 weeks. Using that initial impression, we place a component in, it's like a hard plastic that we'll place back in, so you'll leave with the same shape of your teeth that you came in with. When you come back in 2 weeks, remove the individual veneers, place on the permanent.
Wow. And do veneers, how long do they last?
They can last a lifetime. Again, depends on your situation. If you bite your nails, if you try to open a soda can or soda bottle, if you eat hard crunchy, but I hope not.
No. It's bottle opener.
Yeah.
Smart.
Yeah.
Okay, and what's the investment for veneers?
Veneers can run roughly about $500 per tooth. It varies depending on demographics. If you're in the city, it depends on where you are.
Okay.
500 to 1,000 depends on the dentist.
That's a lot. So maybe we want to try what you have next instead, because it's probably not that much of an investment, right? So what do we have here?
So this is basically just a take home. This is similar. This comes in two different percentages. So 20% or 35%. 20% patients can wear overnight, 35% 1 hour per day. I usually will ask a patient if they're sensitive already or if they're prone to sensitive teeth. I'll recommend the 20%, not the 35%. Again, it comes into play that some patients want a quick result. They don't want to sleep with trays in their mouth, so they'll choose the 35% option for 1 hour. This usually runs about $200 for 4 tubes, which includes the bleaching trays as well.
Okay.
The third is something called sheer white that we offer, and this is $50. And this is basically just like Crest white strips. This is basically just a strip that you apply. Open this up. It comes with 5 inside the kit.
Okay.
And you can see there.
Oh, wow. Yeah. So you just stick this right on?
And you fold it over, and again, this will not adapt to your tooth specifically.
Right.
This can vary from patient to patient. If you have a big smile, big teeth, if you have small teeth, it's going to cover most of them. It can be dangerous in that respect.
And so you leave this on for how long?
Leave this on for 1 to 2 hours. Again, don't overdo it. Use the Sensodyne as well to keep from being sensitive. It also contains potassium nitrate, but not fluoride. So it's an anti-sensitivity, but not protecting your enamel.
Okay, and that's what the fluoride does, just to remind everybody watching. That's why we need the fluoride, right? For
Strengthen
protection.
your teeth.
Strength, yeah. Okay, excellent. That was fabulous. Thank you for that.
You're welcome.
All right, so moving on, let's talk a little bit about jaw pain. So I have another interesting statistic that I wanted to share with you guys. So more than 15% of American adults suffer from chronic facial pain, such as jaw pain, headaches, or earaches. So jaw pain is a serious problem. I know that I see a lot of it in my office. Dr. Zach sees a lot of jaw pain.
Absolutely.
Or we're going to be talking about the TMJ or TMJD, which is just the dysfunction of the actual joint. So Dr. Jill, what do you suggest for pain in your office? If someone came to you and they maybe had a jaw ache and we've ruled out cavity, they've come to see you, they're done with you, nothing's bad, send them over to Dr. Jill. What types of things naturally would you suggest for pain?
So there are lots of compounds that are naturally anti-inflammatory, so they can help and reduce any of the itises. So if there's an arthritis or if there's some kind of inflammation due to either a malalignment or or to a chronic TMJ kind of issue. For example, curcumin, which is the active compound found in the spice of turmeric, highly anti-inflammatory and can really help to reduce that type of inflammatory pain. There are a whole body of compounds called enzymes. Boswellia is one. Another one is bromelain, which is found in pineapple. And that can also help to reduce an inflammatory response and thereby reducing pain.
That's really good. And pineapple's easy. You can put that in salad, you can put that in your smoothie. I read an interesting study about the turmeric that you were saying, and it can be more powerful than a Tylenol.
Yeah.
So it's something that we want to think about. It's really safe. Do you put turmeric in your smoothies at all?
I usually cook with it.
Okay.
It's one of the main spices I use. Like if I'm cooking meat, a lot of times I cook with turmeric and garlic and cumin. Just try to put a lot of anti-inflammatory spices in my food. Yeah.
So Dr. Zach, you have some interesting ways that you treat TMJ in the office, and we wanted to show everybody how you could get your jaw evaluated. So again, if you've ruled out a cavity, maybe you can have a chiropractor take a look at what's happening with your range of motion and see if there's any deviation. So Dr. Zach's gonna come on over here. I'm gonna be demonstrated on, and I actually have a problem with my TMJ on the right side. So this will be interesting. I'm going to share it with everyone.
Okay. So I do get a lot of people who come in and tell me they have TMJ, but we all have TMJ. TMJ is just the joint.
Yeah.
We all have these two joints on the side, which connect our jaw to our skull, and they're very unique in that they both have to work in unison. So they basically have to do the same thing at the same time, and we use our jaw a lot. We talk, we eat, we breathe, so it's very easy for us to have some sort of dysfunction.
And I talk a lot.
Okay, yeah. So you definitely have something. But yeah, so it's throughout our life we're eating, talking, we're using our jaw all the time. So it's very common for TMJD, temporal mandibular joint dysfunction.
Yes.
I find that a lot of times there's actually a different underlying cause that's causing the dysfunction.
Stress.
Stress is a big one. Yes. Sometimes a bite, like some people have a bite that's off, their teeth do not click
Like
properly,
overbite,
and
right? Yeah.
and we refer to a dentist or orthodontist for that. But sometimes from a direct blow or just from holding your jaw in improper position, there is a musculoskeletal. That's how it started, from just the jaw being off. So what I would do is first I would just kind of look at you, open your jaw,
Okay.
open, close. I would ask, do you have any pain when you're doing that at all?
Absolutely. All right-sided stuff.
Okay.
But you could probably see it deviate,
Yeah,
right?
a little bit.
Absolutely.
So then I would kind of palpate your jaw right here and just ask you to open and close a few times. So I can kind of feel her jaw shifting to one side, open all the way, and going back to the other side.
Unlock your jaw.
So the first thing I would want to do is I would use my rapid release tool. And what this is going to do is it's going to loosen up the muscles, it's going to break up scar tissue and adhesions. So our bodies are always changing.
Yeah.
And like when we work out, we get big. When we sit and do nothing, we kind of lose our muscle and gain some fat. So if we're holding our jaw is aligned improperly, we can lay down scar tissue and adhesions that can make it stiff or harder for us to kind of correct our bite. So I'm going to turn
So
this
you're
on.
going to use this right on the muscle?
I would
or-
use this on the muscle and this kind of more around the joint.
Okay, okay.
And what it is high-speed vibration. So
Okay.
it feels good. It's not painful. Most patients like it. Some are a little ticklish.
I'm
So what I would
ready.
do is I'm going
It sounds worse than it's actually going to be.
to have you stay right here.
Okay.
Just going to kind of use it right here. I'm going to have you kind of open and close a little bit. And close and open. And just to kind of even you out, we're going to use it on the other side too. So let's have you open and close. And sometimes I would even use it up here. So some people who get headaches, they don't realize that their headaches are coming actually from their temporal mandibular joint dysfunction.
Right.
And then I would also, I have actually something else I want to show to you.
This is good. I
Yeah.
have a feeling it might be an adjusting tool for the face. But this is good. I'm excited for everyone to see this because chiropractors, when people think about chiropractic, they think about adjustments, they think about neck, low back, but you can really adjust any joint. So I'm excited for Dr. Zach to show us this.
Here's my ArthroStim unit, and I can use this on any joint in your body, but I'm going to use this on
cool.
your jaw today, yeah.
All right.
It's kind of like an adjusting gun, if you will. So it can go very light. Let me see your hand. So it can go very light like this, and then bigger joints, if you push against it hard, like that, the intensity can kind of go up. So,
But for the job, you
Yeah.
obviously want to be
Yeah.
a little bit more gentle.
okay. So what I'm going to do is I'm just going to ask you to open and close again. Okay, open, close, open. Okay, and close. And just let your jaw hang just a little bit. Let your jaw open just a little bit.
Okay.
There we go, perfect. And what I'm going to do is I'm just going to kind of put some motion in. And ask you to open all the way. Good, all right. And then I like to do both sides just to make sure. Yours kind of
Keep
deviates.
me even,
Yeah.
please.
This side kind of deviates the other way on the way up, so I'm going to have you open your jaw all the way. And then what I'm going to have you do is kind of just slowly bring your mouth back to close. Good. And it's simple as that.
And it feels really good.
That's good.
Have you ever seen that before?
I have not seen that before, but it seems the same as doing back therapy. It's a
Yeah.
great idea. I mean, it's all muscle right there in the face, so I think that's a great idea. It's a great tool.
Yeah.
And this is where I think it goes back to having a health team. Thank you so much.
No problem.
Having a health team. So you have your dentist, you have your chiropractor, you have your naturopath, you have your family doctor. Everyone works really well together, and so the idea being that you have options. There's so many different things that you can try that are natural, that are safe, that are healthy. So one more thing I wanted to talk about is a night guard. Do you use a night guard, Dr. Jill? No TMJ issues? That's amazing.
No stress.
No, yeah. We need to do what you're doing, clearly.
all the
right?
turmeric.
Yeah, it's all the turmeric. That's exactly what it is. Let's talk about a night guard. How much of an investment is a night guard?
$350 is usually what a night guard would cost without insurance. Some insurance companies will cover a night guard because, just some are necessary. There's some insurance companies that require you to write a narrative, is what it's called, to explain why it's necessary for the individual patient.
But generally, if a
I do
patient,
wear one.
yeah, so do I. If you're grinding your teeth at night, which contributes to this whole TMJ stuff, how does a night guard stop this teeth grinding? And so when you're grinding your teeth, this is what Dr. Zach was saying about the headaches, feeling tightness up here, and all the jaw muscles. And they're tiny too, right? So once they're stressed, it's really going to change the function quite quickly.
So that's true. So what a night guard does, in essence, is it allows the pressure from the jaw muscles to be released. Basically, it keeps you at a slight opening to alleviate the pressure that you'd normally get when you're clenched or grinding. Another purpose of the night guard, which is a small plastic, and you can see it's a lot harder than the bleaching tray, is if you're a grinder or a clencher, you're wearing away healthy teeth enamel as well. By wearing this, you're protecting it. That leads grinding your teeth away and losing enamel leads back to what we discussed, which is tooth sensitivity.
And can you actually lose teeth from grinding too much?
You can, because teeth can fracture, crack if they have large restorations in them. They can also fracture if you have brittle teeth.
Okay. And what advice do you give for patients who say maybe they wear it, but they wake up and it's not inside anymore?
Then that means it wasn't made properly.
Oh, really?
There are some, yes, there are some patients that this should have a very tight fit. As you can see, that's not coming off at all. That's how it should fit. However, some patients are sleeping in the middle of the night, realize that it's uncomfortable, will take it out and toss it to the side of the bedroom unconsciously,
right?
not knowing it, and find it at the foot of their bed. Also keep it away from dogs, because dogs love night guards. They will eat them.
So since we're talking about stress, Dr. Jill, can you give us some solutions that people could maybe start tomorrow just to kind of ease some of the stress?
Well, for nighttime stress, one of the nicest things to do is have a cup of tea before, as part of a sleep hygiene sleep routine. So like an hour before bed, to kind of have a routine that you have for yourself that involves some relaxing tea, like a chamomile or a passion flower. Maybe having a bath, maybe doing some journal writing, just doing something to help your system start to unwind so that when you get into bed, you're actually prepared to sleep. And some of the stress of the day has already been processed and released.
Good. What are your thoughts about magnesium before
Great.
bed?
Lovely. Magnesium is a muscle relaxant and very gentle, and so it's relaxing for sort of skeletal muscle, but it's very conducive for sleep because your body is relaxed. Yeah, it's a great idea. You can do it to get magnesium in. You can do a bath with Epsom salts, and that's a nice source.
That's good.
Yeah, that's a nice source of magnesium getting in through your skin.
And so do you worry about dehydration with the Epsom salt baths? Do you ever no, you don't say you have to drink X amount of water if you're going to be in an Epsom
No,
salt bath?
I've never seen in practice it be so extreme that anyone dehydrated.
Okay, so that's good to know.
It is.
Dr. Zach, do you have a bedtime routine that you use to de-stress?
Sometimes I do take a magnesium supplement.
Okay.
Milk and magnesium sometimes kind of lets me wind down at the end of the day. I do drink tea sometimes, like she was saying, chamomile tea, but I'm usually pretty tired at the end of the day, so it's not hard for me to go to sleep.
One note, if you tuned in just for whitening purposes only, don't go to sleep right after drinking this tea and letting it sit on your teeth. You will not get your results.
Right.
Good to know. This is good to know. It's all about time management. It's strategy. We need a strategy.
Absolutely.
Dr. Zach, I wanted you to hopefully touch on the soft tissue treatment that you do inside the jaw. Can you give us some insight on what that is?
Yeah.
In addition to the instrument adjusting that you do?
Okay, so we use this group of muscles when we chew called muscles of mastication, and a lot of them are actually on the outside of our jaw, but there are some that we can only access by going intraorally. So what we do is we wear a glove and we kind of just massage the inside of your mouth, and these muscles are the muscles that kind of close your jaw, so sometimes they can get really, really tight to the point where you're not able to close all the way or open all the way. So we kind of take our finger and just gently massage the inside of your mouth, and it's not the most pleasant treatment, but it's very, very effective.
Excellent. Thank you for that.
No problem.
Okay, so now it's my most favorite part where Dr. Jill's going to show us foods that can help keep our mouth in check. So we're going to go take a look at your top choices.
Great.
Okay? So food really is medicine, and this is what I get really excited about when we can educate people on foods that they can use to help, and this specifically for oral health. So why do you choose these foods, and how exactly is this going to work? How does it benefit?
So each tooth has its own lymphatic circulation. The lymph system in your body are basically the garbage collectors. And so each tooth has its own lymphatic circulation. And what we want is for the lymph to function in a way that it throws bacteria from inside the tooth outside so that it can be eliminated. The foods that you eat are partially responsible for the direction that that lymph flows.
Okay.
So if you're eating foods that are highly processed, high in sugar, the lymph circulation is more likely to go the reverse way, which would draw bacteria into each tooth, and that we don't want.
And that's going to lead to the cavity.
That's going to lead to cavities, it's going to lead to gum disease, it's going to lead to periodontal disease. Yes.
Yeah. Okay, so what's up first? Which food do
Okay,
you
so
suggest?
here we have crunchy vegetables,
Yes.
celery and carrots.
Okay.
So these guys are known as dental detergents.
Oh, I like that.
They are. So they're crunchy, they're high in fiber, and they increase the flow of saliva. Saliva is our body's natural defense against gum disease and cavities.
Okay.
Apples
So-
too, and so it could be fruit too. Like cabbage, all the things that are crunchy, that are high in fiber are going to work in the same way.
Okay, and does it matter the amount?
It doesn't, but these should be part of your daily diet.
Okay.
So
So you want to utilize them every single day?
every single day. I mean, every single day should have at least 10 servings of vegetables. So
Yes,
that's-
exactly.
So there you have it.
Okay, what's up
so
next?
next we have beautiful green tea. This is matcha green tea. So green tea is, first of all, anti-inflammatory. It's high in what are called polyphenols. Polyphenols are a type of antioxidant.
Okay.
And there's some evidence that supports that green tea may actually slow and reduce the growth of bacteria that are responsible for gum disease and for bad breath.
Oh yeah, bad breath, that's a good one.
Yeah.
Good one. So again, you can have this daily, really easy. And look at this green color, that's amazing. When it's this green,
It's
you
gotta
know
be
it's
good.
Yeah, exactly. Okay, what's up next?
So here we have a stalk of broccoli. So broccoli is high in vitamin C, along with strawberries and kiwi. Vitamin C is involved in the production of collagen, and collagen in our gums are what helps to keep the integrity of the gum. So eating your vitamin C is good for maintaining the integrity of the gums.
And so meaning the gums are strong. So for example, if you're flossing and your gums are bleeding, right? Is this what you mean by keeping it strong?
That's part of what I mean. If you
Okay.
think about the way that the gum hugs the tooth, so you can if you think about the way that that shirts work. There are crew necks, there
Yeah.
are scoop necks, and then there are turtlenecks.
Yeah.
And there are boat necks, right? So you want the gum to hug the tooth in the way of a turtleneck would, a nice snug fit, as opposed to a boat neck where the gum is actually receding. That's where we get in trouble because then you get bacteria up inside.
Yes, and we don't want the bacteria to hang out. So eat your broccoli.
Eat your broccoli.
Yes, okay.
The next one, this is yogurt. So this is a goat yogurt, but fermented dairy. There was a study that came out of Denmark that showed that fermented dairy might actually be protective against periodontal disease, and that might be because of the bacteria that are in fermented dairy, or it could also be the calcium. So probably a combination of both.
Excellent. A bunch of really great options. Thank you for sharing.
Thank you.
All right, let's go back and see what the guys are up to. Thanks so much, Dr. Jill. I especially love the nuts and seeds. I know we're all going to make some trail mix tomorrow, for sure. We're going to wrap up with some final thoughts. Thank you, doctor, so much. I really appreciate it. Dr. Turner, any final words?
Take care of your teeth, brush, floss. It's important. Everything in moderation. And, a smile is the first thing that people will see when they see you. So make sure you keep it healthy and beautiful.
That's all the time we have here today at MyNEWPhilly.com, where something's always new and
Everything is always Philly.